In last year's report, we also identified several mental health indicators as data to watch over the next few years. Like most of the information we are presenting today, we still do not know the full impact of the pandemic. However, as you can see here, between 2018 and 2021 in Vermont, there has been a 60% increase in the proportion of children ages 3 to 8 with an emotional or mental health condition, including anxiety, depression, and a behavioral or conduct problem. This 60% increase is even more striking when compared to the US as a whole, which did not change during the same time period. There's also ample anecdotal evidence that the need for children's mental health services is increasing, not only in the number of children requiring services, but also the acuity of those needs. However, as you will see, the utilization of services is not necessarily matching those increases. Vermont's mental health system has multiple levels of, can you go back one slide? Thanks. Vermont's mental health system has multiple levels of supports and services, from outpatient and community-based supports to crisis management, inpatient care, and residential treatment. However, a key part of this continuum is missing. As you likely know, prevention is more effective and less expensive than treatment. However, two critical federal resources, Medicaid and the Mental Health Block Grant, cannot be used for prevention and the promotion of mental health activities. Medicaid requires a diagnosis for services, and the Mental Health Block Grant can only be used for youth with severe emotional disturbance. The lack of federal funding for upstream prevention and promotion services is impeding Vermont's ability to turn the curve on wellness. For those with a diagnosis, Vermont's 12 designated mental health agencies, or DAs, provide both routine mental health services and crisis services for those children needing immediate care. In this chart, the dark blue bars show the number of children receiving routine mental health services, and the light blue line shows the number of children receiving crisis services. When the two indicators are taken together, the data show that when there are fewer children receiving routine services, the number of children accessing crisis services is higher. While awaiting a placement, children with a primary mental health diagnosis may end up boarding in an emergency department. In 2019, there were 1,500 discharges from emergency departments for children with a primary mental health diagnosis, and 16% of those children waited 2 or more days for a placement. These placements can include residential treatment. However, locating a bed for children is increasingly difficult. Vermont currently has the lowest number of out-of-home treatment beds in over 2 decades. In addition to full program closures, some programs have had to temporarily close beds or shift from 7 to 5 days of operations per week. All of these trends continue to be important to watch as we support children and families in recovering from the ongoing impacts of the COVID-19 pandemic. We are at a critical moment in the continuing public health emergency of early childhood mental health, a moment which will have long-term consequences based on our action or inaction.